So our procedure is quite different than normal chiropractic offices. When you walk in the door, first thing you do is we do a really thorough examination and determine if we need x-rays. If we do x-rays, we do a very detailed set of x-rays. It's not just your shoot it straight on and shoot it from the side. We actually do several motion things where we have you bend your head all the way forward and all the way back while we take the picture, so we can see if it's participating. If you've got some stuck joints, you go back and they're going to stay there, and so we can see that on the x-ray. We do very detailed x-rays, and then after that we do an analysis. So the doctor sits down, goes over the x-rays, goes over the exam, compares the two, decides what's the best treatment for you. Typical visit looks like this. You come in the office, you do stretching on your neck to get through the muscles, and then you do traction, so you go up on a device that helps pull the curve back in your neck, and you do that over and over, and then helps to pull it in. And then you sit on a chair that wobbles. It's called a wobble chair, and you get a rock and do lots of different stretches and exercises, and it really helps to rehabilitate and warm up those muscles and change the discs inside. After that, then the doctor's going to do a test on you to see if you're flopping over to one side. If you are, then there's a problem in the brain that we need to work on. So we do some stimulation to the brain to help you feel balanced. Then we do chiropractic adjustments, do some treatments through there. We'll check to see if you're able to touch your head all the way forward and all the way back. If not, then we do a special machine that we drop down, and it helps to free up that motion so you can be able to touch your head, and sometimes instantly be able to look all the way back. After that, we'll do some different exercises, some of which we'll put a weight on your head, because if you put a weight, it pulls down the head a little bit, which then kicks in the muscles and the reflexes that bring your head back up, which then strengthens the muscles in the back. So we do those exercises. Then there's some balance and proprioception. That's your body's knowledge where a joint is in space. So basically, if we can get you have better balance, we can prolong your life. Because if you've ever known an older person that has a hip fracture from falling, it's usually a one-way trip to the hospital, and we want to avoid that. So basically a typical office visit looks like with us. And then when you go home, you're doing exercises at home. So a lot of that equipment you have at home and you do it every day, and that's why we get the big changes we do. It's not just about the adjustment, which is really important, but we also rehabilitate and strengthen the muscles that support it.